Hi, I'm Dr. Rios, and welcome to the Rios Center for Plastic Surgery. By this time, you've probably had a chance to meet my amazing nurses and staff who got you ready and got you back to the pre-op area. Today, I wanted to spend a little bit of time talking about tummy tucks and what to expect today, what to expect tonight, and what to expect during the recovery time. 5 or 10 minutes after you speak to me, you're going to speak to Chris, who's going to give you the general anesthesia today. And what that means is he's going to come and talk to you and answer your questions. And when he's done, he's going to put a little medicine in your IV. And after that, you're going to be very relaxed and you won't remember anything. You may not remember until you get home. Once we give you the anesthesia, we'll escort your loved ones to the front. And they're welcome to stay here for the entire surgery, or they can run some errands and we can call them back so that they can come and see you and get some more information from our nurses. After the surgery, you're going to be in the recovery room with one of our nurses. When you're a little bit more awake, we'll get your clothes on, and then your loved ones will be escorted back to be with you. Eventually, you're going to be able to go home or to a hotel. And you will have an appointment in the morning with us, and I'll talk about that in just a little bit. But when you wake up, you're going to wake up with an abdominal binder. It's a little white Velcro strap that we're going to put around your tummy to help secure the tummy tuck so that you feel more secure when you cough or you need to move. The Velcro strap will be placed on you during surgery, and afterwards, when you're at home, if you're laying down, you could undo the Velcro strap for periods of time and then place it back on. 2 weeks or so after the surgery, we're going to replace the Velcro strap with a girdle. You're also going to wake up one drainage tube. Now that might seem a little scary, but it's actually very easy to take care of these tubes. My nurse is going to show you and your loved one how to take care of the tube. As a matter of fact, when you come tomorrow for your appointment, we'll check on the tube and make sure that it's working correctly. You can expect to have this tube for 1 to 2 weeks. After that period of time, we're going to remove the tube, and then we're going to switch you from your abdominal binder to a girdle. While you have the drain in place, we're going to give you a paper where you're going to record how much comes out of that drain. Again, my nursing staff will show you how to record the drain, and you'll bring that record to your appointment so we can determine when we can take out your tube. Now, when you go home today, you're going to be very tired, and so you're going to sleep a lot. If you sleep on your back, it might be a good idea to put some pillows underneath your knees and maybe some underneath your head and your back in order to relieve the pressure from your tummy. You can also sleep on the side and curl up like a baby to relieve the pressure from the tummy tuck. Now, later on, I'm going to want you to walk around when you're at home. Now, at first, you'll probably be sleeping, but you're going to have to walk to go to the bathroom. Have one of your loved ones assist you when you're going to the bathroom and walk a little bit extra around the rooms. Eventually, I'm going to want you to get in a chair and watch TV, but that may be a few hours after the surgery. Now, when it comes to food, you may not be that hungry at first. You may not have an appetite, but I'm going to want you to drink a lot of water, but I'm also going to want you to drink Gatorade and other liquids that have sugar in them. That way you won't get a headache. A milkshake is a very good type of liquid to take right after surgery. It's going to give you calories. It's going to make you feel better. So if one of your loved ones later on in the evening can get you a milkshake, I think you'll really appreciate that. Now, if you feel like you can eat a little bit more, you can go ahead and advance your diet to soft food, even the night of surgery. What does that mean? You can have soups, you can have eggs, you can have peanut butter, Jell-O, and pudding. In a day or two, if you feel like eating regular food, you can go ahead and advance your diet as you feel like you can. Now, as far as walking around, I do want you to start getting up and moving like I talked about before. At first, when you're going to the bathroom, walk a little bit extra, but in the next day or two after the surgery, I want you to maybe think about walking around every hour, and maybe walk around for a minute or two, maybe 3 minutes, and just start moving, because we know that when people move, they do so much better. There's less risk, there's less complications. Things just go so much better if people start moving. You might have noticed that you have some stockings on your legs. We want you to wear these stockings for the next 3 days. They're going to promote circulation in your legs so that you don't get a blood clot in your legs. So just keep them on for the next 3 days. We're going to have them on during the entire surgery, and you're just going to keep them on for the next 3 days. My nurse also showed you a little machine, and it might seem a little confusing, but it's a machine where you're going to breathe in, and what we want you to do is to breathe in order to expand your lungs, because if your lungs collapse, you can get a pneumonia, you can get fever, and you might have to be admitted to the hospital for IV antibiotics. So this little machine that we're going to give to you helps prevent these things from happening. And the way that you want to use it is while you're awake, not while you're sleeping, but while you're awake. You want to use it every hour, and you want to take in 4 to 6 good deep breaths. On this little machine, there's a little yellow marker that shows you what we would like for you to get to. And so every hour while you're awake, take in 4 to 6 deep breaths and try to go beyond this marker. My nurse will teach you how to do this again. She'll teach you how to put it together. It's very simple, but we're going to send you home with it, and I want you to use it for the next week while you're recuperating from the tummy tuck. Now, as far as showers are concerned, I think you might want to avoid taking a shower for a day or two, because you might get very weak in a hot shower. So when you first go into a shower, maybe on the second day, you definitely want to have somebody with you to help you. And what you want to do is mostly shower to your back and have your loved one assist you cleaning you in the front areas. Eventually, when we get the little tube out, you'll be able to take a very, very good shower. You can still get the tube a little wet, but I don't want a lot of water directed towards the tube. Now, there's 2 things that you can help me with to help you heal. The first is getting a protein powder mix, and you can get any protein powder that you want. You can go to GNC or maybe even HEB and just get a good tasting powder, protein powder mix. You can get vanilla, chocolate, or strawberry. And I want you to take at least 1 or 2 scoops twice a day and put it into a tumbler, and mix it up with half milk and half water, and take a protein drink twice a day. That'll help your incisions heal a lot quicker. Remember, this isn't a time that you necessarily want to go on a diet. Your body is going to need calories and a lot of protein. So in addition to the protein powder, you're going to want to eat a lot of protein. Chicken, fish, and meat, tuna, all these things will help your incision heal a lot quicker. Now, the pain medication will also cause you to possibly have some constipation. So we're going to want you to buy a powder that's called Miralax, and I'm going to show you a picture of this here in just a second. And it's very easy to use the Miralax. It comes in a little jug, and what you do is you take the cap off and you pour the powder into the cap, and then you pour that into some sort of drink that you like, water, juice, whatever you want, and you just take it once a day. And you're going to want to start that even today. Hopefully you've started it 2 or 3 days before, because it'll get in your system and it'll help you go to the bathroom, because I don't want you to be straining in 2 or 3 days after the surgery, straining against our abdominoplasty repair, because you'll experience a lot of discomfort. So go ahead and get going on this, and I think you'll see a lot of positive benefits from using the Miralax powder. Now let's talk a little bit about pain control. During surgery, we're going to put a small patch of medicine on one of your inner arms. And that patch of medicine is going to give you medicine through your skin continuously for 3 days. And we're going to put that patch on at the beginning of the case so that it's working by the time we're done with the procedure. So this patch is going to help you for the first 3 days after the procedure. We're also going to tell you how to use the pain medication that we prescribed to you. So the nurses will be going over that with you. They're going to write it down so that your family will understand how to use the pain medication. Now, you're going to have an appointment tomorrow. Today you came in through the front door and you're going to go out the back door. Tomorrow I want you to come to one of our side doors and you'll see it there. It has a doorbell. So we're going to write down the time that you need to be here tomorrow. We're going to write it down on your instruction sheets. Come at that time. Don't come earlier. Try not to come too much later because we'll be expecting you. We're trying to fix you into my schedule for tomorrow so that I can see you. So come at the time that we tell you to come. And when you come tomorrow, we're going to change the bandages. We're going to take a look at that tube and make sure that you're doing okay with it. And we're going to give you one injection. And that injection is very important. It helps slightly thin your blood so we can prevent a blood clot in your leg. And we're going to do the first one tomorrow morning. And then we're going to show you how to do it for the next 4 or 5 days. We'll be giving you those injections here. And tomorrow we'll demonstrate how they work. Now, the last thing I kind of want to go over is what to expect over the next few weeks. So by the end of the first week, I want you to be walking straight. On the day of surgery, you might have a tendency to walk a little hunched over, but I actually do a technique where you could be walking straight the next day. So when people come for their follow-up appointment the day after surgery, a lot of them have their makeup on and they're already walking straight. So I hope that you'll be able to do that. But by the end of the first week, you need to have the goal to be walking straight. The tube is going to probably be in there between the first and second week. It depends on how much drainage comes out of it. When we take that tube out, we're going to switch you from the abdominal binder to the girdle, and that'll happen about the second week. In the third week, you might be able to drive, and by 6 weeks, we're going to allow you to do normal activities like jump in the ocean, do Zumba, just normal activities again. Now remember, tummy tucks are probably one of our toughest surgeries, and so there's some persistent swelling. So even at 6 weeks, people are going to still want to wear their girdle for maybe 2 to 3 months more. There will be some persistent swelling, and you may not get your final result until 6 months after the surgery, but you'll see a big improvement up to that point. Also remember, there may be a little bit of numbness in the abdominal region. That could take several months for it to go away. It shouldn't bother you, but now that you know that it's going to happen, you'll know that's a normal part of surgery. So I hope all these instructions were very helpful for you. I'll be in a few minutes to talk to you, to talk to your loved ones, answer any questions you have, and we'll do some preliminary markings for the tummy tuck. And then again after that, you'll talk to Chris, who'll be giving you the anesthesia. So I'll see you in a few minutes, and thanks for choosing us to do your surgery.